Hey my awesome people, this is Dr. Shivaam. I hope you can see me, right? So you have come to your last days of NeetPG 2021 and I know how tough is this phase for you. That is why I thought to just tell you some important points in this last days of your NeetPG. I know how important this time is for you, and I was not able to talk to so many people and solve their queries individually. So let us talk here in this live session. Now, the main important focus for you in this live session is to make you realize that nothing is too difficult, right? So this phase that you are going, you still have time. Just remember the phase when you were giving your MBBS profs and other, when you were completing so many things in just one day, right? So you still have, if you see, you still have a week with you. So don't get anxiety, pressure or anything that will reduce your output for the main exam. And to achieve success in anything, you need these four pillars, that is mindset, soul set, heart set and the beast mode, right? So have that mindset that you will be able to crack this exam because you have been working for so long, right? So don't have any uncertainty in your mind, because if you think like exam pattern badal gaya hai, so exam pattern badal gaya is exam pattern has changed for everybody, right? It is not that exam सिर्फ मेरे लिए बदला है या उसके लिए बदला है, it has changed for everybody. So यहाँ पे क्या होता है कि there is an advantage and there is a disadvantage. The advantage is everybody has to face the new type of questions, right? Disadvantages, because you were preparing, so you think you are more prone to the previous year's type of question. But realize that when I got selected, or whenever the success rate of the selection is more, there is always a drift in the pattern of question. I cleared my exam in 2017, then also there was change in the pattern. So take this change in pattern as a good signal for your results that would be coming, right? So I am saying take this in a positive note that the exam questions will be new for everybody, and if it is new and you are solid in your concept, you will be able to answer it. So don't think that exam would be difficult. Think like exam would be new for everybody, and the result will depend how effectively you will be able to analyze the questions. So in this new pattern, you will be getting more time to read and understand the question. So tip number 1 is be patient, control your nerves and read the question properly, right? Read the question properly, read the options properly, and then try to answer. Because what is happening, if I give you an example, there was a question where the patient was giving a history of coming from a war zone, and in the question it was given that the patient came with the complaints of hearing loss. Patient was a soldier coming from a war zone. Then they had said patient was taking some ototoxic drug also, right? But that was a systemic drug and not for, or you can say the patient was taking hydrochlorothiazide for hypertension. And then in the options, the reasons were sensorineural hearing loss due to ototoxicity or due to noise trauma. They also gave a audiometry, that is where you were seeing a dip at 4K. So what all they are trying to do is they want to confuse you between the hearing loss of a ototoxic drug or due to noise trauma. So you know that there is a dip in the 4K when it is due to noise trauma. So once you read, you will be able to answer it properly. So don't get confused with the questions, because anyway examiners know or they want you to confuse. So once you read the question properly, you will be, or you definitely would be able to answer it, right? Another thing is, what is needed at this present time is your perseverance. Any great thing, any great achievement that has been achieved is not because that person was very intelligent or that person was great. It is achieved due to the perseverance and the daily efforts that they have been putting over the time, right? If an intelligent person, or if your intelligent friend is not giving the efforts, is not reading, he won't be able to perform well. But if you, being an average one, is giving more efforts than the intelligent one, you will be able to score more. So don't think that you are less than anybody. What will determine success in this exam is your hard work. Take this 7 days as do or die, right? Go into the beast mode and give whatever you have, give the maximum that you have. Take this part as a challenge, right? So challenges are the things that makes our life interesting, and overcoming them gives you a feel of goodness. So if you take this exam as a challenge, you will be able to do it, and I believe that you will be able to do it. So I want you all to be remembered as you have tried. I'm not saying you to top the exam, but in whatever time you have, at least give your 100%, right? I would say give your 110%, because this 10-15 days, if you keep on working, if you keep on the push or the thrust that you were giving for these long, you will be able to perform very good, right? So just think the day when your result is coming, you should not have any regret that you have given less effort that was needed for this exam. So don't get any procrastination, any fear that whether you will be able to answer in the main exam or not. Believe that whatever you read in this 10-15 days, everything you will be able to remember. And I'll tell you that whatever you have read from the very first day of your MBBS life, everything will be helping you to clear this exam. So don't think that your preparation is just this 1 or 2 months. Many people have this doubt that, sir, I have started seriously just 4 months before, I was doing duties before that, will I be able to compete with the other people who are just sitting and reading for 2 years? Remember that whatever work you have done, whatever knowledge, medical knowledge you have gained from the first day of your medical life, everything is going to help you in this main exam. So this exam is not about what you have read last year. This exam is all about what you know and how skillfully you can apply your knowledge to solve the questions. So be relaxed, be chilled, right? So you all are cool people. Be cool and you will be able to get where you want to be, right? So I want you all to keep on trying in whatever days that are left, because yes, it will make a difference. Whatever you will do will make a difference in your career. And what you can do in this left 7 days is try to solve more MCQ and just focus on the revision, right? Just focus on the revision. If you have made notes, read it again. If you have read from some app, revise them again. And what extra you can do is focus more on the clinical subjects means starting from the pathology, pharmacology, then coming to the third year subjects, eye, ENT, then final year, that is your medicine, gynae ops, orthopedics, psychiatry, dermatology. So, and these things, basically the clinical parts, because what they will be doing is they will be giving you a clinical scenario. They will be presenting a patient to you like you see in emergency ward or in the OPD. From there, they can enter the pharmacology. From there they'll enter the anatomy, right? You are getting my point. So they'll start with the clinical scenario, like a patient presented to you with angina. Now they can ask you what you will be giving, what drug you will be giving, what investigation you will be doing. So this is the approach, this is the right way actually of asking question, because anyway once you become a doctor you have to treat a patient as a whole. You can't treat a patient like a ear patient or a nose patient or a throat patient. You have to treat him as a whole, right? So this is the way they want you to understand and become a good doctor, right? So in these last days, don't lose hope, don't think that you can't do it. Think that everything and this thing is possible for you. I don't know about other things, but getting a good rank, getting a good seat that you deserve is possible for you. So keep your face towards the sunshine and the shadow will be falling behind. So this means these many days are not for having a low energy. These days are for reaching your maximum. Eat healthy, sleep healthy, and put whatever you have in the time that is left. I am not here to tell you what to read, what not to read, how to read. By now you know everything, you have done your maximum. Don't feel that you are less than anybody, your preparation is less than anybody. Think like you are the best candidate that is going to sit in the examination, right? Don't think that your friend is superior to you, he know better than you. I'll tell you examples. Means I have seen from my life, from my career, there were many friends of mine in the pre-medical era also who were like, I have read it 10 times, I have read it 5 times, and I was the one who was not able to complete even once, right? But I got selected and they also got selected, but second or third time. So it doesn't matter ki how many times you have revised. What matters is how good you are at grasping things, how good you are in reading it, even if you are reading it once. So have that faith that you are the best. And in these many days, one tip that I would want you to give is try repeating some affirmations to you, right? So in the night time, try saying to you that you have a fantastic memory and your fantastic memory will be remembering everything in the exam, right? So try saying this statement 5 times. I have a fantastic memory, my fantastic memory will be remembering everything, right? So this will help you to reduce the procrastination, the fear that whether you will be able to recall things in the exam, whether you will be able to remember the pharmacology which has been revised 1 month back, because you can't revise everything, all the 19 subjects in this 7-10 days. You have to act smartly, right? You have to act smartly and try to finish off things that are left. So be smart at the things in this last time and believe that you will be able to do it, right? So you will be able to do it, and I want to hear the success story from you, because I want, you are the ones who are coming, newer generation. So I want you all to inspire your juniors. I started these things because I wanted to help you all, right? Although my time these days are little busy, but still I wanted to talk to you to convey that still things are possible. Don't lose hope. For the ones who are thinking that it is not possible for you, I am telling you that you still can do it. Try to revise whatever things that are left. Try to read those subjects in which you are having fear. If you are having fear in pharmacology, pick it up now and read some chapters. It will help you to reduce your fear. If you have left anything like ECG in medicine, read it now. There is no time, that means the time will never be more. If you think that this 1 week is less, I will tell you that time will never be more. If your exam would be tomorrow, then you should be reading like this. Means assume that your exam is not 2 weeks after, assume that your exam is tomorrow and read whatever you want to read now and today itself, right? So with the positive note, I will end this, and what I can do is I can give you my number in the details, where you can, like, if you have any more doubts, you can WhatsApp me. Okay, so I'll be replying you whenever I get time. Another thing is, I'll post a link where this PDF is there, how not to miss things. Basically, this is a collection of some important topics from each subject. So I want you all to go through it. It will hardly takes 10-15 minutes of your everyday that is left. But what it will do is, it will revise your important charts. It will revise your important topics from each 19 subjects, right? So it is available in Amazon, but delivery would take it time. You download the app, it is there, you will get the PDF and read it, right? In this last time, I want you to not to miss things that everybody else know. So this is another one strategy, that in any competition, what is important is not to make mistakes in the common things. If you are mistaking in the common things, you are out of the race. So you have to try to make all the questions that others are making right, that everybody knows, that has been taught by your coaching. Because if you think that DAMS has taught this, so every student of DAMS would be having that thing in their notes, and there is high probability that everybody out there will be making it right. So if you make that thing wrong, you are somewhere lagging behind. Same applies for Marrow, same applies for Prep Ladder and any other platform. So try to not to make mistakes in the common things, and that is only possible if you keep on revising the core things and do not move out of it in this last time, because you can't cover everything. Every subject is so vast that it takes a lifetime to understand and read it. In this last time, just focus on the main things, revise the less read subjects or the fear subjects, focus more on clinical because of the new pattern, and have faith that you will be able to do it. So we'll meet after the exam, and I want to know how you have managed your difficult time and conquered and reached to your position when this exams gets over, right? So life is beautiful. Just have some more patience for few days and you will be there where you want to reach. So I would end this with this, and if you don't know me, I am an ENT and head neck surgeon, Shivam Kesavani, right? So I run this channel. I just started this channel as a hobby, and whenever I get time, I try to make videos to help you all. I also have an app, that is Medex. You can get it from the app store. It is there. You can download it. We'll be putting more content, and I have authored some book. So this is my short intro, and I love to interact with you all, help you all in whatever time I get. So all the love and best wishes from myself. Stay happy and stay healthy in this COVID time. Second wave is coming. Use all the possible precautions, because I don't want anybody of you to get ill in this difficult, in this crucial time, I must say. And do whatever it takes to reach where you are dreaming of or where you are destined to, right? So stay happy, take care, and all the best. Thank you.